Recent research shows quite clearly that we've probably been misled and have misunderstood the underlying mechanism of diabetes. As it turns out, and although this will sound shocking, diabetes is more related to a fat toxicity than a core problem with carbohydrate metabolism. So the body's inability to properly manage sugar is a consequence of fat toxicity. What happens in type 2 diabetes, which is the most common type, is you get a buildup of fat within the cell, and then the insulin receptor doesn't work, leaving the sugar outside the cell, which leaves sugar high then in the bloodstream. And we measure high sugars and say, oh, you're diabetic because you have high sugars, and that's the nature of the name of diabetes, and it's a marker of diabetes. But the actual core problem is an excessive fat intake. And that's been shown to be the case because when you put people on a lower fat plant-based diet, a lot of that intracellular fat burns away, gets metabolized, and then the insulin receptor can work. The sugar can be brought inside the cell, which is the role of insulin, which acts like a key to open up the doors, which lets glucose inside the cell. And then people can, even those who've been diabetic for decades, can significantly improve their diabetes control or even be rendered non-diabetic and actually reverse their diabetes. So it's kind of ironic, and part of probably the reason why people are so confused is because we're too focused on blaming sugar as the problem. The core of the problem with most diabetes is fat. Simple sugars and candies are not good for you, but that a T-bone steak is more diabetogenic than sugary foods in and of themselves, because the core problem is fat. Diabetes is a fat toxicity, and that's its underlying mechanism. So a plant-based diet, it's been estimated if you drop people down for 12 weeks in a plant-based dietary immersion program and they couldn't eat high-fat foods, that between 90 and 95% of type 2 diabetics would be rendered non-diabetic by week 12. Which again, like I say to people, you have a right to eat basically whatever you want, but every new diabetic should at least be made aware of this fact that food is not just important for managing diabetes, is potentially a significant option and an ability to even reverse the condition to begin with. And yes, well-controlled diabetes is our goal in the diabetic, but shouldn't it be, how about reversing the condition altogether?